Okay, if I might call you all to order. My lords.
Just wait. Because it's 10 seconds for the live stream to come up.
Okay.
Okay, right.
Thank you. Good morning, ladies and gentlemen. Good morning, Sir Paul, and thank you for coming to this session. We are on now on live stream on the internet, and if I might suggest to the noble lords, when you're asking a question, please press the button on your speaker, then you'll be heard and will be recorded. So all the sessions are recorded. So thank you for coming. We'd like to explore with you, Sir Paul, the life sciences industrial strategy and what your views might be about it, but also other issues related to see how we can help as a House of Lords Science and Technology Committee. So if I can kick off, I'd like to hear what your overall impression is of the Sir John Bell's life sciences industrial strategy, and also what do you think will sustain it in the long run and what needs to be done about it. One of the other 5 pillars it identifies, 5 issues it identifies, one of them is the science offer. What do you understand by what the meaning of that science offer means? So, and please feel free about any issues, because we like to really hear your views rather than be guarded about it.
Well, thank you, and if I could just welcome the committee to the Crick. It's great to have you here. Can I first of all comment on what I see are the really good points about the life sciences strategy? I think first is it's making a bid to convince government of the importance of the life sciences, which is absolutely correct, and I think that goes through at the report. In particular, the emphasis on the science base. We know that we've been languishing in the lower part of the table of OECD funding and the statement, and that we should be moving up to the upper quartile is the very least that we should be doing. I also happen to like, and we can explore a little more later if you wish, the emphasis being put on the role for the NHS in this strategy. I would actually emphasize it perhaps even stronger. I'd use words like we have to develop an NHS which is a research engine for biomedical activities and healthcare delivery, a research engine which puts the UK in a unique position. It identifies problems which are important too, particularly scale up, although I don't see too many solutions there, but I'll come to that when I say the comments that I think need to be dealt with. Scale up, I think, is crucial. And the other important point that it recognises the exceedingly important issue of skills, having appropriate skills, and the ability to recruit from around the world the very best. All these are in the report and are good features. What do I think perhaps requires some more attention? In a very general sense, I think the report perhaps lacks detail to know quite how you go to the next step. It's of course a strategic document, so it's bound to be high level, but I think that it identifies problems but does not always identify, even in general terms, what the solutions might be, and I think that is a bit of a weakness. Implementation is crucial in some of these areas, and without a better sense of how it's going to be implemented in a strategic way, I think it will lack the momentum to be able to proceed. So I think there's more detail required. Second point I would say is that it is not actually a life sciences strategy. It's a health sciences strategy. And I think that needs to be made absolutely clear. Now, I have no problem with it being a health sciences strategy, and indeed, in the forward, it's essentially identified as such. But there's 2 points to be made about it. The first is it loses the opportunity for synergy and connection with the life sciences elsewhere outside biomedicine, which is significant in this country and which is important in its own right economically. So we lack that synergy. The second thing that worries me is that it is possible, because it's called a life sciences strategy, that this other important sector will be ignored. And this is actually a fundamental weakness here, which I think absolutely needs to be addressed. Now, I would be content if it was simply called a health sciences strategy and then we did something about life sciences to try and fix this. But if we don't have a connection to the life sciences, we will lose an opportunity, and I'm worried that the government may feel that it has a strategy across the life sciences when in fact it does not. It only has a strategy across part of the life sciences. So I would say those are the two most general points that I think would concern me. One is it's a bit light on detail, even at the strategic level, and in some parts quite light. And the second is that it's only dealing with a restricted part.
So what, in your view, needs to happen next? And we take the point about life sciences not including other sciences, but only human sciences. But to stick to the strategy as it is,
yeah.
What should be the next, and who should do it? Who
Yes.
should drive the...
So we need to get the other life sciences in. That could be done by another study, but we shouldn't ignore it.
Yeah.
What I think is required before we can take this forward is a greater attention on how a number of the important issues have been identified, how we can actually solve them. I mean, I think I already mentioned the scale-up. It's identified, but I read the scale-up, and I couldn't see anything there that really solved it. Now, I don't mean to imply that's simple. That's why I read it, because I wanted to know what one could do. But I think there needs to be more attention. It sometimes had a sort of feel of a sort of McKinsey report, you know, one of these sort of boilerplate things, and identifying the issues, but not necessarily getting to grips with some of the dirty work of actually finding solutions. So I think it needs more work on implementation and the strategies that can drive the practical consequences of it. I know I'm not answering what should be done. I'm saying it's a problem, though.
Okay. No, please, if you speak in between, it picks up and is recorded. So I'm sorry to have to refrain you from doing that. Can I ask Baroness Young now?
One of the previous members of this committee, Peter Hennessy, said that the problem with the last 93 industrial strategies was that there wasn't an implementation plan, and you've just identified that. I mean, who should be given the job of kind of masterminding and maintaining the drive forward? Because I think the other problem with implementation of these strategies is that people wander off after quite a short time, and then there's another one comes along and it doesn't get implemented either. So, I mean, should we have a go-lighter for implementation? Where should that sit?
Yeah, I think it's I think it is a problem here, and I think it's been seen in the past. So this is why I'm particularly concerned with it. I think I'd have liked to have seen in a report at this level more attention, but I think it's probably too late at this point for this particular report. So I think the details have to be put in place by some other mechanism, is what I'm saying, rather than a conventional report. Now, where could that sit? Well, it might be a role for UKRI. It might be. I'm not sure it is, but UKRI does have a broad grasp of the science research issues. I don't think it was set up to quite deal with this, but I mean, it might provide an opportunity there. I think another possibility is to go back into an appropriate, I'm not sure quite where the appropriate one is, government department to actually try and to find out how to develop this. You see, I'm struggling a bit because I think we've lost the opportunity in some respects. How it should work. Now, John Bell himself's done a really good job in Oscar, for example, and Oscar would cover some of this territory, so that could be another route that could build it. but I've already commented that I think it's a rather narrow, it's just a bit too narrow. So I'm struggling to know quite what to do here. I suppose you could involve think tanks and so on. I'm not really a fan of that. I think I would go into something around UKRI. The CST could at least discuss it. I mean, it would give them something to do, and that would be, I think, sorry, I didn't mean that in a pejorative, having sat on it for 15 years, but what I meant is that it would be something that would be a meaty project for them to do. But I think it's got to be somewhere in the government support system, somewhere. I'm sorry, I know I haven't given a good answer.
You commented earlier on that NHS should become the research engine. Would you like to expand on that? How are we going to do that?
I think there needs to be a culture change in the NHS, that it isn't simply a healthcare delivery system. It is also a real opportunity, particularly through data, and that's really well stated in this report, especially through data, that if we can persuade the public, and I want to say something about that, to engage in providing personal data, we have a fantastic opportunity, which you asked me about in the private session about the US. There is nothing like the NHS in the United States, for example. And the United States is rather inefficient in its healthcare delivery. We have a number of structures here. Sometimes we beat ourselves up too much. Having worked there, I saw how inefficient it actually was. You only have to look at the cost of healthcare delivery to see that we actually have something that is working pretty effectively. But it will work even more effectively if we can turn it into a research engine. And that is a culture change, which means that we shouldn't be just constantly driving, you know how it's so complicated, hospitals, GPs and so on, but we have to somehow get into the way of operating that it has to provide data, research data, that will be for the good of society. Can I just amplify that? One of the big problems with the importance of data, and it sort of comes through a bit here in the report, is that it's clear we need the data, but it's equally clear there's going to be a big fight over getting that data because of public records. Now, there's two issues there. One is confidentiality, and everybody feels the focus on getting the codes right so it can't be released. That's only part of the problem. I think the second problem that maybe the NHS can solve is to persuade our public that they are contributing to the public good by contributing their data and their information. I think this should be a case of the public good. And that means we need to think very carefully how we set this up. It isn't simply a matter of solely a public-private partnerships, which obviously can provide one way forward, because I think the big stumbling block is to get the public engaged. So the NHS is not only a research engine, but it might provide a way of getting access if we emphasise the public good of public data, of patient data.
Lord Fox, and then I go to the Foxborough.
Accepting all of the positive things you said about the NHS, it's clearly stretched, and as a healthcare delivery system, which is how most people who work within the NHS identify themselves, and sits front and centre into that culture, how do you set out to change the culture? How do you incentivise different behaviours? How do you frankly make them possible within the capacity of an organisation which is already running at over 100% in many cases? So how do you affect that change?
Well, it's money, 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 I suppose. I mean, it needs more money, is I would say, in part. I would also say, don't forget that the Department of Health is one of the few government departments that still has a research budget. I mean, of £1 billion a year, approximately. And I think that looking at that budget and maybe expanding that budget, which is separate from the healthcare delivery, to actually drive research in the way that I think we'd all agree would be a good idea, I think would be the way I would start. So I think just dumping money into the healthcare delivery system may not be the answer, but to drive it through the research fund may be.
Already, but you worked in the US a lot. And do you feel that we could, anything else that you've not said that you feel we should be doing to make it easier to move good ideas out of the laboratory, past to the bed, to contribute to healthcare and make money?
I think one, I said it a little bit in the evidence, and I said it more in the report I wrote that led to UKRI. I think there is one problem which I think needs to be dealt with, and it is roughly like this. To translate too quickly may result in you becoming lost in translation. Because, and it's the way science is done. If you're exploring a subject, doing research into a subject, then the way it works, if you, for example, aware of Karl Popper and the way he's spoken about these things, is that you do experiment, you make observations to test a hypothesis. If the hypothesis fails, you change the hypothesis, and your objectives are changing all the time to follow the research evidence. That's how we operate. Now, if you are doing translation and even more so application research, which is trying to get to a particular objective, then that results in a problem. Let's say this is our objective, that glass of water. Let's say we are starting here with this paperclip. Then when you're doing conventional discovery research, you may start in that direction, but your first experiment could bring you here, your next one over here, and you're lost. If, on the other hand, your objective is that glass of water, you get lost in all of this. So how do we deal with that? I think, first of all, recognize it as an issue, because this wastes money. So we have an immediate start-up for something, with some crazy idea, and of course it fails because it's not sensible. The answer is twofold. One, let's get a bit closer with our knowledge of the paperclip and the glass of water. So, I mean, that's one thing, so that it's a more reasonable ask. The second I would suggest is that sometimes the term valley of death is used here, and people talk about the finance. I think what helps here is to build bridgeheads out from both sides. If we have no capability on the applied side, industry or healthcare, then they can't recognise stuff coming in from the other side. So I would say two things in general terms. Let's not have too long a moonshot. I want to say something about moonshots. I don't like moonshots as a term, but it really is a moonshot. Let's try and avoid it and make it a sort of much closer. And secondly, let's have capability on both sides so we can reach out. So that would be one.
I think that one of the problems we have in looking at both the biomedical area and in other areas as well, you get university or other research groups who have a great idea of which they work. And effectively, they become one-trick horses. In other words, what they've done is very good, and it may have a particular application, but it isn't actually going to expand into much bigger things. And going back to what you said previously, I mean, isn't the best solution for that sort of company, in fact, to be bought up by a big one?
Well, what I think it reflects is the fact there's a lack of close contact on both sides here, and which is exactly the way that we're trying to deal with it in the Crick, as I was explaining earlier, by having closer contacts very early to learn those sorts of things. Because people like me are by no means expert in knowing these sorts of issues, and the mistake is to pretend that we are. But by closer contact, we will learn and we will respond to that information from elsewhere.
Did you find in the US that the companies who were interested in helping people across the valley of death, were much better informed than their opposite numbers in this country? We're really talking about the level of education in a rather specialised sense of venture capitalists?
Yes, I mean, we do have good venture capitalists who are specialists in this area in the country. I don't think we have enough of them, and I don't think they control enough funding. And what I found in the US, or in the area of New York, and I think it would be the same on the West Coast, New York and Boston particularly, was that there were real experts who understood the territory, who were in the investment industry, and who also had very close contact with academics. So at Rockefeller, every month or two, I would have a breakfast meeting, because that's what they do in the US, for a couple of hours at 7:30 with the Wall Street investment guys and girls. I was using guys just for the state of record in the American usage of the word, which covers both sexes, and the people we have in Rockefeller, where they would just mix and have coffee together, get a few talks. We need more of that, and that's something actually the Crick could contribute to go back to an earlier question.
So this is part of your mission, to educate and indeed change the venture capital industry in this area.
It will be when we have the air conditioning working, yeah.
Right, okay, good, thank you.
Hands up. I've noted you all. So it was Baroness Young first, then Lord Fox, and then Lord Valence.
Could I just pick up that issue and take it one step further? Because you talked about the more venture capitalists who've got more money in the States,
Yep.
as well as the different climate. Does that mean we're stuffed forever? You know, because we are a smallish country and are going to have a limited amount of scale. Is scale an endemic problem that's going to last forever, or is there anything we can do about it?
Well, it is, of course, and I hadn't mentioned the size of the market, but this is, of course, one issue we're going to face with Brexit. We did have a large market in the EU. It wasn't perfect, and it wasn't as permeable as it is in the US, but it was there. And turning our back on Europe will dramatically reduce our market. And that's another factor in here when thinking, naturally, I mean, I'm no economist, but I mean, that's another factor in how these would go. So we're going to have to work very, very hard to find our market.
Winding back from scale up to the sort of early translation period, the formation of UKRI, which to some extent was presaged and by your own report, brings together research and Innovate UK. What's your assessment in terms of the risks and the opportunities of pulling together 7 research councils and Innovate into that organisation, and what benefits, what has to be done to deliver the benefits?
The author of the report has to defend now.
My main argument for putting them together in this way was to have a strong voice for science in government, because I found in my evidence, when I took evidence, that the relationship with all the different research councils, and for that matter Innovate UK, was weak with BIS, as it was then, because they could always be picked off one at a time. So my notion was a strong body that could make the voice for science, inhabited by a strong board and strong individuals who could make the case for science. Now, the 7 will come to the research councils and then to Innovate UK. So the research councils have been really very good in their original form in their relationships with their constituencies on the whole. I think that's worked effectively. But it was inefficient with the back offices, which were all duplicated and different, and that I think just got in the way. But they didn't have the individual strength to argue the case, which I'm hoping will be the case. Now, some people have worried about Innovate UK because it would lose its identity. I was actually a little neutral about whether it should be in or out in the report I wrote. I was slightly in favour of it going in because I feel that these different funding agencies need to be talking with each other. I didn't think in any sense of the word, any sense at all, that Innovate UK should be the tech transfer company of the research councils. That would be crazy. But because they occupy adjacent territories, I thought it would make it more efficient and effective. So I think there is a theoretical danger, but if it's run properly, I just don't think it should be an issue. That's my own personal view.
You've partly answered my question already, Sir Paul. I'm coming back to capital now and capital availability. And earlier on, you mentioned that when you were at the Rockefeller, there was plenty of what you called gung-ho capital. Yes. Whereas here we've got the Treasury looking at breathing life into patient capital. And in a way, that sort of says it all. Now, gung-ho capital is to do with enthusiasm. I'm sure here you've got lots of enthusiastic scientists. And is it partly an issue of how you translate the enthusiasm of science into a new breed of enthusiastic finance people? And is there a difference between enthusiasm at the translation point and at the scale-up point, and how you deal with the two?
Well, I think my experience, frankly, is more at the former than the scale-up. So I can certainly address that. I think it's simple. We need to get our communities to mix and talk to each other. And I mean, both in an informal way, the parties for the 30-year-olds, as well as a formal sense for those with white hair who might be setting strategies. So I think that we just need to talk more. And surely we have an opportunity in the City of London with great research. London is a city of science and great finance.
Exactly. There's a language of science, a language of industry, a language of finance, and a language of politics. And they don't all work together. And I think you're absolutely right. We have to breed a new generation of polyglots.
It has been said that we get a chance to explore when we see some of the investor to take evidence. But one of the differences, I'm familiar with West Coast, not East Coast like yourself, but it was that it was easier for companies to be developed and then get onto the stock market. That's where they raise their money than it is here. But I don't know that.
Well, this is a bit beyond my pay scale because I'm not a financier. But I'd make two observations. I think one, which isn't quite as you're asking it. I think that we have to recognize that at least at the early stage, there's a lot of risk with these sorts of initiatives. And that the people who drive translation through setting up companies and so on, recognize that risk and realize that though they may get engaged with a company, it may well collapse and there have to be other opportunities to go somewhere else. And this has been extremely important in my understanding in Boston, where you can move from one to another. I think we have possibilities in Cambridge, where the critical mass is building up. I think that we should try and develop something similar in London. So I think that would help significantly if you have a collection of, let's call them entrepreneur translators who can move from company to company, then we can have a more secure way of doing it. So that's one way I think I would think about that.
Can I just go back to your, I thought, a very important point about the public must be interested in being involved in medicine. I have the story, my own story was that I had a very severe operation at Queen Square when I was 12 years old. But after that, I was obviously such a sort of a prize product. I was sat there and tears and tears of doctors wanted to see about me. So I was rather pleased about that. But I mean, but it is an important question of people being interested in their treatment, and I wonder whether, you know, that you must get, that must be the big theme, as opposed to the theme of people being worried about privacy.
Well, I think the obsession with privacy will get in the way of this data revolution, and as was described in the life sciences, unless we solve it. And I do think this notion of the public good, engagement of the public, interest in them, in the NHS, because free at the source, does provide a way to approach this that perhaps hasn't been exploited enough. So I think, you know, I'm not sure whether that would work, but I think it gives us another possibility. And we have to therefore be careful about quite what arrangements we put in place. I would like to say something more about data, which is back more to the life sciences strategy, if I just may. The emphasis is on genome sequencing, lots of genome sequencing. Now, I happen to be a genome sequencer, and so I'm very sympathetic to it, or part of what we do. But I think that there's two further things that are required. That sequencing has to be coupled to phenotypic outcome, that is to clinical outcomes. And I do not see the same efficiency and effectiveness in the connection of outcomes for individuals to that DNA sequencing. If we don't have that in place, then I think that's going to be a problem. It's very easy to sequence. You just put it on the machine and out comes the letters. Connecting it to good and usable records is crucial for this, and I think there needs to be attention to that. That's recognised, but I'm not sure it's solved. The next one I don't think is so clearly recognised. As well as genes, we have environment. Changes in in its most general sense. There's not a mention of the word environment here. Not a mention of it. Now, we will need, in the longer term, and we're certainly not there at the moment, to also collect information about, in its most general sense, the effects of the environment on the human being. If you then combine the genomics with that, you have a much more powerful paradigm to work with, because the environment affects how the genome influences the outcomes. Now, we again can use the NHS to monitor that. There's various things we can do, but epidemiology and population studies are crucial here, but they are not being, it's not being thought of in the same way. That's at least my view, and that was a lack, I think, in just focusing on genomes. I know I wasn't asked that, but I...
Well, 500,000 biobank and 100,000 genome does have phenotypic information. Okay, I accept that it doesn't have the epigenetic information. You don't think sequencing that genome will create enough data for...
I think that we need reliable outcomes, and I'm not sure that that's... but you can ask some experts who will come after me who think about this. And the effects of environment are simply not there at all. And we know very well that will influence what the outcome will be. And the epigenome may provide information that records in part some of the environmental exposures, in actual fact. That's an area of research which is prevalent in, say, insecticide usage and what impact it has on people. So I think there is interesting things here that could be developed which haven't been touched upon.
Lord Maxwell, quickly, then I'm going to Lord...
Yeah, could I just say that on data, that one of the problems, and I agree with you, by the way, that we ought to be combining all our data so that we can, but there is a problem of confidentiality in data, that if it is an international business, as it is, then we have that data can be shared with other people outside of this country. And it does affect, however, if it's not confidential, it affects employment, it affects insurance, it affects all sorts of other ways of life. And that is a major problem for data.
Well, I can only agree completely. I mean, we do... what I said is we have to solve the problem of confidentiality, which should be a technical one, combined with will, of course, but we also need to have the right data, and that's what I was challenging.
We have a data legislation, data protection legislation going through just now, as you know, and yesterday we had several hours, but over an hour, particularly focusing on patient information and biological research information and use of data. And I don't think we found a solution yet, but you're quite right. The solution needs to be found, otherwise we're not going to... Lord Renfrew.
Thank you. We've already referred to Brexit, but do you feel that it's going to get us bogged down or get research institutes like the Crick bogged down in various ways, or are there perhaps some opportunities that might accompany it?
Well, from my perspective, there's very few opportunities. From my perspective, I've seen very few opportunities, really, because we have, of course, many people from outside the European Union who have to go through the normal visa applications. It's expensive, tedious, and it puts people off. So what we require, if we leave the EU, where we have rather greater permeability and fluidity, we need to simplify the immigration system. But, of course, a significant amount of the pressure to leave the EU was in fact to make it more difficult. And I think we've got a real dilemma there. So I think getting people into the country will require, in my view, simplification of the visas and so on. A second point, which perhaps isn't said enough, people worry about funding, they worry about EU networks and so on. All of that's true. But for me, going around, as I do, quite a few countries in the world, the real problem we've got is our image. And our image is suffering terribly at this moment. They feel, other countries feel we're just turning our back on the world, not just on Europe, on the world. And the second point that has to be made, that image, that's made even worse by the fact that we know that if the vote had been left to younger people and more highly educated people, it would have gone the other way. And so we are alienating the very people that we need. This isn't helped by the posturing of some politicians, because that's hits the headlines out there. That's what they read. There's lots of sympathy on the science side, but we're losing all that sympathy by the image that we're presenting politically. And I know I'm saying something. I think we need to be much more robust in a political sense in embracing what the world will bring to us. Thank you.
Is it having an effect on your recruitment at a junior level?
It hasn't yet. I'll say something about it. We've had one junior group leader recruitment, which was a year ago, so just after Brexit. We were really looking for 3 junior group leader appointments. We had nearly 400 applicants. 80% that came from overseas, and so it had no impact at that point. We are just about to close our present search, so I will have a comparator given what's happened in the last year, but I can't tell you what it is yet, but if you ask me in a few weeks, I will be able to do so. I also have figures on our graduate program, which is at a lower level. There we had, it's extraordinary, 1,300 applicants for our graduate program of 40 individuals. Can you imagine? It's completely overwhelming. And we have, therefore, large numbers, big data in this case, large numbers of, which will give us a percentage of UK, EU, outside the UK, and the rest of the world. We will have 3 data points and see where it's going. Interestingly, last year, what dropped, and it was a 40% drop, was applicants from outside the EU in the rest of the world. And that addresses this point I was saying about our image.
You referred earlier to your dislike of the term moonshot.
Yeah.
Can I ask you about the Sir John Bell's strategy regarding HARP, which is a sort of DARPA-like program?
Well, I think HARP is a good thing, but quite difficult to deliver well, which is the reason why I was saying we need to dig under it as to how to deliver it. Because defining moonshots is quite difficult. The reason I don't like moonshots is the following, that you're an engineer, and I hope you'll agree with what I'm about to say. The moonshot was built on Newtonian physics, which is 1700, and bigger V2 rockets. And what was required to make it work was political will and money. Of course it needed, well, the amount of computing was relatively low, of course. But what I'm trying to say is that it isn't the same territory. It's not a good metaphor for this stuff. It just isn't. Because that is a metaphor where if you throw money at something, the problem will solve itself, which it did. But trying to understand how human life works, or how life works, and thinking of ways in which we can use it, is something that requires a lot more work into understanding how the world works before we can do it. That's why I don't like moonshot. And whilst I'm on a rant over this, I'll say something about risk. It's understood here, but if you just read the summaries, they say we should be funding risky research. I mean, it's utterly absurd to say we should fund risky research. What we should do is fund bold and ambitious research, which is actually in there, and minimize the risk. Yet this is translated into saying we should fund risky research. Now, this will get out there. Sooner or later, somebody's going to read this sentence and say, what are these turkeys doing saying we should fund risky research? Of course we shouldn't. We should fund bold and ambitious research and minimise risk. They know that, but it's when it gets turned into this sort of, sound bites that it just loses sense.
And what about the multiple partners aspect of the HARP programme?
I think that's okay. I like multiple partners, but you've got to get them to work together. Two problems. You've got to get them to work together, and that requires understanding human nature and where people come from. And the second most difficult thing is identifying the nature of the moonshot. There was only one moon, so you knew what to aim at. But in fact, there are lots of moons in this endeavour, and I don't know how to work that out. And I think that needs attention.
And the funding for HARP, how do you think that will work? It's a bit unclear as to what's meant in John Bell's report.
Yes, I wasn't quite sure what it meant. I mean, I'm used to setting things up, not understanding where the funding's coming from and hoping that it will continue. But so I don't think I worry too much about that yet. But what you're reflecting is there is a lack of strategic detail that is needed to deliver some of this stuff, which doesn't mean this isn't a good thing. I think it's a good thing, but I think delivering it is pretty difficult.
Can I have a small rant and then a question?
Yeah.
I'm kind of keen on moonshots. I'll tell you why. When I was at Diabetes UK, it used to drive me insane that we were so close to developing a vaccine, inverted commas, against type 1 diabetes, which would revolutionise the lives of children across the globe. But we could not corral the research community in an effective way to just focus on that. We knew what the moon was. The moon was there. So for me, the big challenge was what the Yanks did crack with the moon programme, and that was basically a sustained corralling of research effort and anticipating what the problems would be and starting the research on the problems before they actually hit the problems. So it was doing it in parallel rather than in series. Whereas when we were doing the type 1 vaccine, everybody was working in series, and then it was going to stretch into infinity forever. So discuss.
Discuss. It's not... My objection...
Don't discuss the science of the vaccine development.
No, I won't. I don't understand. You've got an immunologist over there who's coming up. You can ask him about that. But it's not that I'm against the corralling. I'm in favour of it. That's what I tried to say. I'm actually just objecting to the word. I don't like moonshot because I don't think it describes what's actually going on. But I am saying I think it's quite difficult to deliver because it's difficult to corral. And what would be nice to see is how we can actually deliver that. I suspect we're not so far apart. Was that the rant? Was there a question after it, or was it? No.
The question was, do you think that, irrespective of the name moonshot, do you think there is a merit in trying to pull off some of these targeted research programs?
If we can deliver it well, yes, I definitely think so. I think actually the difficulty is delivering it well. And we don't have a tradition of that in this country, of doing that, in the way that you said. And so that's what's got to be solved. I don't think anybody has a problem with it, at least I certainly don't. But delivering it, I think, is a bit of a struggle.
Lord Oxford, you had a question that I stopped you from asking.
It's already been answered.
You're fine, you have. Now, Paul, you're allowed to have more rents. So the question I was going to ask you is, I was going to say, just tell me one thing that you would like to see in our report. There was a strong recommendation that will help to drive the strategy or improve it. But you could have 5 shots at it.
Well, I think we need a proper life strategy, so we need an additional add-on. I think that we need a more strategic detail to solve some of these problems which have been correctly identified, and we've noticed some of them as we've gone through, but which require greater strategic thinking as to how to deliver them in the context of the UK and the culture of the UK. And I think that is required if we are going to implement this at all effectively. I think that and now I'm going to some specifics, I think that genomics, in which, of course, the UK is a world leader, is fantastically good to promote. It needs, I think, connection to other data, which I think the NHS can provide, both for clinical outcome and for the environment. The third is just difficult. It needs research. It's not something we can do, but we should be planning for that. So I think we should be doing that. I think we need to think back to the corralling, the point you made, of how we can get all the different parts of the community working together. And I think that obviously money helps there, but there's something to do with the chemistry of individuals. Look, we sort of think if we just take a scientist and a clinician and an engineer and mix them together, they're all going to get on. The reality is that they're trained in rather different ways. Scientists are a bunch of anarchists who, if they don't have any, if they don't know an answer to a problem, they'll just sit on the fence and say we need to do more experiments. Okay, you don't want to go to your doctor and say, well, come back to me in 6 months when you've developed something else, and I'll tell you what to do. They operate in a completely different structure. It's a hierarchical structure. It's one which has to come to decisions quickly with the real situation. You mix these people together, and we need some sociology, in my view, to actually get them to talk properly together. I think that's an interesting thing that we could do here. I'm not sure. I mean, we've got several clinicians around the table here. I mean, teaching our highly trained clinicians to handle small quantities of liquid, which is what we sort of do in laboratories most of the time, I'm not sure is the best use of their skill set. I think we should, they should have, I'm going off the point here. I think that we need to get different types of people working better together. And that requires different things from just mixing them and giving them money.
Do you think the strategy is likely to succeed?
Sorry?
Do you think the strategy is likely to succeed?
I think that the objective of the strategy is a good one. I said that at the very beginning. I think it's identified important problems, but I think if it's going to succeed, it needs more work at implementation and how it's going to deliver things. And if it doesn't get that, it will not succeed. If it gets that, it has a chance of succeeding.
Well, on that note, thank you very much, Paul. Thank you for hosting us, and thank you for this session. It'll be most interesting.
Thank you.
And we will have 5 minutes when we're off stream, and then we'll get your colleagues to Are we on the stream? My lords, can I call you all to order, please, because we're about to go on stream.
Yeah.
Good morning, everyone. Just to tell you that we are on stream, so we're live, and if you have any conversation, it will be picked up and recorded and be on the Lord Fox. Good morning and welcome to you. Thank you for getting off your important research and coming here to give us evidence. It will be very helpful to hear from you, particularly your views as scientists, as it pertains to the life sciences strategy, and how do scientists take their, particularly their science, and I know we've read about the science you're all involved in. So I'm going to ask you first to introduce yourself from my left. And if you want to say anything as a way of introduction, please do so. Otherwise, we'll go straight into questions. Please.
Good morning. I'm Caetano Reyes Souza. I'm a senior group leader here at the Francis Crick Institute. My laboratory has a research program looking at how white blood cells get mobilized to fight infection and cancer.
Hi, I'm Dr. Kathy Neacon. I'm a group leader at the Francis Crick Institute.
You're all very soft. Either you speak loudly
or
yes. Somebody pushes
Apologies.
the volume up.
I will bring it closer. Our lab is interested in understanding aspects of early human development, human embryo development, and its application to stem cell biology, and I'm very happy to help the committee.
Good morning. I'm Charlie Swanton. I'm a senior group leader as well here at the Francis Crick Institute and thoracic oncologist at University College London Hospital. My lab is interested in understanding the process of drug resistance in human cancers, why drug resistance is inevitable in solid tumours, why we can't cure metastatic disease, and how we can make drugs more affordable, essentially, and work for longer and hopefully cure one day.
Morning. My name's Simon Bolton. I'm a senior group leader here at Francis Crick as well. My group is interested in mechanisms linked to cancer, particularly in how the integrity of the genome is maintained. I also have an active interest in translation. I helped to establish a biotech company where I spend 20% of my time involved in science strategy.
Good morning. My name is Véronique Biraud. I'm the head of translation at the Crick, so I have a unique role of being accountable for one of our pillar strategy, which is accelerate discoveries and translations to health and wealth. I've also an unusual background. I'm a chemical engineer with a PhD in life science. I've spent 16 years in industry, and the last 4 years I came to UCL and then to the Crick.
Thank you very much. The question is to all of you. But I can see that the question, as is framed, pertains more to 3 of you and not to 2 of you. But we like to hear from all of you, and you might answer it in terms of translation, how you might help, and you might answer in terms of what you had to do to take your science to innovation. So my question really is: you're all doing exciting science. That's clear, okay? And the kind of science that obviously is likely to go to innovations and improving healthcare. So do you think about taking your science to innovation? And if you do, what barriers do you think you might face, and who might help you and facilitate you in that? Or do you not think of it at all, as we've been told by some other scientists, that scientists don't think of their science going to innovation, they don't think about IP, they just do their science? Who'd like to start? Any one of you can start, come on.
I believe a lot of academics don't actually think about translation. I think in part that's a cultural issue. We're addressing that here at the Crick, as you've heard from my colleague here. We're putting in place structures that help to educate academics in terms of how you can translate. I think this isn't widespread in the UK, and it could be significantly improved. I think the Crick could be a very good model for how you bring together the appropriate people to allow people to translate. But I think it's a lack of understanding as to what is needed to take a discovery that we make, for example, in our laboratories, to the next stage. How you engage with venture, how you engage with biotech and pharma. We really don't know, and I think we're changing that here at the Crick.
Okay. Professor Swanton, Dr. Nair.
So we've spent about 18 months setting up through the Crick a spin-out called Achilles Therapeutics. I probably should have declared that conflict at the beginning, apologies. And the aim of that is to try to essentially find T cells in human tumours that recognise antigens on tumour cells that are present in every tumour cell. So, you know, this is sort of the interface between science and business that I've sort of spent a lot of time trying to understand. And it's hugely complex, and there are lots of problems. I mean, the science is complex. Delivering a product like this to patients in a 5-year time frame is high risk, unfortunately. And you need access to long-term capital investment, and you need the entrepreneurs and the business-minded individuals to be able to drive a business model that will attract funding. And we were fortunate to work with Syncona, which is a spin-out of the Wellcome Trust, which actually has that long-term capital. And it's pretty unusual, but it's also quite remarkable. And the people working for it are also very smart. And they've had training both in science, their PhDs, as well as business. And they've developed a business plan. We've got the right people on board, and we've now got up to £28 million invested in this company to develop a therapeutic for patients. But we've thought a lot about what the problems are, and I think, you know, as I mentioned, the problems are access to long-term capital. How do you prevent a US venture capital company coming in and giving a Series B funding and moving everything lock, stock and barrel to the US? I think that's a major concern, and Syncona are in this for the long term, and they promise us they will continue to invest and prevent it moving offshore, which I think is important. So how do you maintain IP, and how do you eventually deliver a therapeutic into the NHS where you can control costs and deliver a therapeutic that is, you know, will improve survival at a cost that the NHS can afford? And these are all things I hope to be able to control to some extent. And then there's the workforce, and I don't think we have the workforce in this country that is suitable to deliver this life sciences strategy, to put it bluntly. So what do I mean by that? What I mean by that is that we don't have the MD PhDs in the UK that the US has. 30% of faculty in US cancer centres are MD PhDs. That's certainly not the case in the UK. And what is the reason for that? Well, in the US, they have an MD PhD program at university level. They train 4,000 MD PhDs at any one time in the US. We have equivalent programs here. We train 8 per year. So we're training our PhDs in medicine far too late. They're training in their 30s when there's just not time to learn the intricacies of science. You know, this idea that we can sort of develop 4 £20 billion companies in the UK in the next 5 to 10 years from this life sciences strategy without a workforce to be able to really, A, understand what the questions are in medicine, and B, you know, efficiently translate the basic science into the clinic, I don't think will happen easily.
As a tomorrow's science, the gene editing. Do you think, as a scientist, that your science may go to innovation, and do you get help?
In terms of our particular research area, which is involved with human embryos and the application of novel genome editing techniques, so that's the inactivation of genes in a human embryo context to understand the basic mechanisms of early human biology. I think one of the, I guess, benefits we've had of working within the UK is that in the UK, it's uniquely acknowledged as an international leader in having proactive regulation in this area. And that includes horizon scanning by the UK regulatory authority, the Human Fertilization and Embryology Authority, and scientific and clinical advances advisory committees who collectively together with legal teams provide the UK regulators with the opportunity to have dialogues about technologies and innovations that are sometimes not developed in the UK, but about the application of those technologies and techniques within UK sciences. And so, in effect, our research benefited from that as kind of directly benefited from that, in that those dialogues happened in 2009, and all of the regulations in effect were discussed, and those approvals happened before the technology caught up. And so when the technology was there to enable us to actually address these key questions that I think internationally have been kind of acknowledged as really fundamentally important to our understanding not only of human biology, but of the application of stem cells potentially in regenerative medicine, we were able to just quickly kind of jump on that. And so that shows, I guess, a strength of a pragmatic regulatory body that provides a sense of, I guess, a sense of kind of public, the public feels, I sense, the public feels that they have delegated this responsibility to this authority, and that's helped provide innovation.
In terms of investigating science to take to innovations, and you mentioned stem cells and regenerative medicine, in which both areas, UK at one time was the leader. We established the first international bank, the stem cell bank. Now, a lot of our scientists who then were working in stem cells and regenerative medicine are now in USA with companies that they've developed because they found. So what we're trying to explore is, why is it that our brilliant scientists cannot take their science in this country to innovation, and it is USA that they go to? What are the barriers? Okay.
So I would like to make a couple of comments. I think the UK has some strengths in taking some of their science to innovation. There is a recent report from Biocentury in May, which was looking at innovation in Europe, and out of the 27 biotechs that were created, 12 were in the UK. So we do have some strengths. Maybe some limitation were already highlighted, which is how we grow our small companies to robust company and how we protect them, that's for sure. Some of the barriers are around the multidisciplinarity we talked about. To be able to accelerate how those discoveries goes to application, you have to embed applied scientists with curiosity-driven scientists, and that's an experiment we're doing here. You have to embed people who can speak finance languages and science languages, like entrepreneur in residence, investors in residence. And that's how you can create an environment where scientists feel supported, that they can take their science to the next step of application.
Can I also suggest one other thing, one other aspect here, is that it's a question of incentives, and I think funders can play a role here in incentivizing translation and potentially spin-outs where appropriate. Most of the application forms for grants, program grants and what have you, have very limited detail in terms of what you need to fill in about whether you've had a spin-out. It doesn't count like, let's say, a Nature, Cell or Science paper would. It's not sort of prioritized as an esteem factor outside this institute, where, you know, increasingly we're being encouraged now to think about this, which is fantastic. But, you know, it's quite unusual, that model in the UK, I think it's fair to say.
An MD, PhD. What about an MD, MBA?
Yeah, absolutely. I think there'd be huge benefits there. I know one or two of my friends who've done just that, actually. Yeah, I think it's about, medicine is so complex now, yes, and requires, you know, such complex skill sets, that I absolutely think there is a role to play there. I think the problem with medical training, in a sense, at medical school level, is that we've paid a lot of attention to training post-qualification, but we haven't really done very much at, you know, between the ages of, let's say, 18 and 24 while you're at medical school, to think about how we can prepare the workforce for the problems and the challenges and opportunities of the future. Medicine's very much stuck in its ways of, you know, you will be an NHS doctor, you will be a service provider, you'll be a medicine, a surgeon, a GP. And that's what's happened for the last 2 centuries, and it will carry on like that for the next 2 centuries, without preparing ourselves for the problems inherent with Brexit and this life sciences strategy, which I think is potentially fantastic if we had the workforce developing now for the future, which I think we can do.
You're a clinical oncologist. Are you an MD or a PhD?
I'm both. I'm an MD, PhD.
So you did both?
Yeah, I was one of the first cohorts of the UCL MD PhD program in '95.
So you did MBBS, then MD, then PhD?
No, I did MBBS and then a PhD. No, so I did MB. So I did a BSc, PhD,
Okay.
MB.
Okay.
So it was an intercalated PhD.
Okay. Lord Fox.
Can we introduce some more acronyms? KEF, Knowledge Exchange Framework, is being touted by the government as a way of rewarding academics for their knowledge exchange and transfer in a similar way to publishing, which is, you know, obviously the current measure that is used to measure your academic prowess. First of all, has that started to impinge at all? And does anybody know about it? And do you think it would actually make any difference?
This is the idea that's floated, and Universities UK think it's not a bad idea, that alongside the TEF, the Teaching Excellence Framework, and the Research Excellence Framework, that we now have a Knowledge Excellence Framework. And with both TEF and REF, money follows.
Yeah, I mean, I think anything that can be done to encourage, you know, broader interactions between science, medicine, and industry is positive. You know, and I think it's fair to say, and some may disagree with me, that, you know, we all love doing science for science's sake. We love that. You know, I love thinking about nothing else other than science. And I have to say, you know, my insights, my limited insights into setting up a small company have been quite painful. And it's tested me to the limits, and I haven't really enjoyed it hugely. But I can see it's absolutely necessary if we're going to commercialize a medicine and get it into patients quickly. Well, I can't do that in the lab, and having those opportunities and you know, having the powers that be both within this institute and outside approve of those activities makes my life a lot easier. So I don't have any pressures from within the institute not to translate, if you know what I mean.
Yes, I mean, I just wanted to sort of add to the mix the fact that it is not necessarily just a matter of not having the appropriate reward that is setting the limit, but we have to think about the overall drive of the individual's concern. I think my colleague put it very well, which is that, you know, he is driven by the science, but of course he's also a trained doctor, and he is driven by patient need and by the opportunity that he sees in commercializing a certain type of medicine in the hope that it will lead to a better patient care. You know, for others who are discovery scientists, you know, what gets us out of bed in the morning is not necessarily the thought that we are going to find something that can be immediately translated into patient benefit. It is certainly the excitement of the discovery, and that I think we share with all sciences, including the physical sciences and others. It is true, however, that in the life sciences there is that additional incentive, the thought that what you are doing might actually help in terms of a better health for the population, and that is always there, and it is something that we can work with and try and promote, and making sure that if those barriers are sufficiently low, that people then do take that step with ease. But you can't sort of force people down that way without understanding their motivations. And as has already been mentioned, there are different types of people involved in the health life sciences research.
Help improve the quality and quantity of life sciences and their funding in the UK. I mean, you've already commented on it, but perhaps others may have some views about the Bell strategy. But you should be answer this question.
So I think Paul has already, you know, highlighted that it has the right element on it, and the implementation is going to be the challenge. I think the HARP is going to provide some additional funding, and some of it will support translation. It's not very clear how this is going to be distributed. One of the key elements is how some of the research councils have been really important in supporting translation, like the MRC and their scheme that is the Confidence in Concept, which for an institute like the Crick, where we are at the foothill of translation, really enable and facilitate how we do those critical experiments and gain confidence in the concept, progress them to the point where they can be adopted by industry or VCs, and that was not very clear in the strategy how, you know, the funding towards that will continue and maybe be increased.
Can I just ask you one question, which comes through this report, of course, is the role of science, of citations as being a measure, some sort of measure of quality. Is there some, do you think, drift? I myself, I'm a scientist, and I find the citation business ridiculous. Pure mathematicians, they don't get a citation for 10 years or 15 years after they publish the paper sometimes. But in other subjects, you know, chemists boil up some little thing and they write a paper the next day. But so it's so uneven. It's so
Don't
uneven.
answer by saying life must be bliss as a mathematician, right?
So I wonder whether, you know, a new light on this whole issue of how science is regarded and therefore funded is coming out of your institute.
I would say I think it's too early to say. I think we have a strategy here that will help this, but I think there's still very much a view that we are judged based on our productivity, where we publish our work. And I think the point that Lord Fox made is very valuable. I think any strategy that will provide an alternative measure of somebody's achievements, whether it's through the kind of work that we do in our laboratories in terms of discovery that we publish. But the challenge is, if you want to translate, many people feel that they need to go into a stealth mode to give yourself a competitive advantage, so that you can, you know, you're not offering this valuable information to the general scientific community, and of course that is then hidden, and it's very difficult to assess, you know, what that is, that measure of where the program is going. And particularly when you start dealing with investors who are putting large amounts of money, they don't want you disclosing this information to anybody else. So I think it's a big problem.
Let me ask that question to Dr. Biro. Isn't that a fallacy there? The assumption on the scientist's part that disclosing your science or getting an IP, which would then forbids you from publishing, and therefore, and the investors don't. Isn't that a fallacy, thinking that?
I think it's important that when we develop innovation, that there is a protection at the beginning, but it will, and certainly here, it will never prevent the scientists to publish. We have to publish our findings, and it's about how we go about protecting our finding that is important, and the timing of it. But it should not stop scientists to publish their science, absolutely.
Yes, my interest is in how you pull through commercialization from science. And we talked a lot about this earlier on, but there are two specific things I'd like a little illumination on. I have no experience of spin-outs. I don't know what it's about. I wonder, can you tell me what you think is the balance, or a sensible balance, between the interests of those who put up the capital, those who are individual scientists who've actually put forward the intellectual side of it, and the institution itself, the Crick? What should the balance between the three be? Because a lot of this is to do with motivation, as you know, who's doing what and why. And those seem to me to be, I think, the three most interested parties.
So I'm going to start, and then the others can jump in. I think Caetano made a very important point that it has to be driven by the scientist who wants to follow that route to take their science forward. Every time we do go down that route, we've considered other routes, and it's important to really think about a tailored approach. And how we consider those routes is by having some of the experts embedded with us. That's the first thing. Now, when we decide to go down this route, it is a balance about protecting the interest of every parties who come and will form that spin-out. The investors will want to have a return on the investment. Of course, that's what they're here for. And they provide something that is a very important asset, a team of experts and the funding that will be necessary to do the first step of getting a proof of concept. The Institute have to protect our academic endeavour, and we have to protect how we can continue to publish, and that's where the tension usually comes. And for the individual, they have also to find with the Institute protecting them how they can balance their academic endeavour and their business endeavour. And every time it's different.
I'm being cruder. I'm not talking about academic interest, I'm talking about financial interest. You know, in a spin-out, you know, what is a reasonable balance between those who put up the capital, those who've had the good thoughts and may have an equity or whatever else interest in the spin-out, and whether the Institute itself should have an equity interest in the spin-out, and if so, what should it be?
Okay.
And should this be a source of potential income for the Institute itself?
So the Crick has a very special setup, which is the translation is core funded, which allow us to have a long-term view of how we put our innovation into capable hands and how the reward comes to the Crick. And in order to not stifle the innovation, we take the view that we should go for a long-term view, and the revenue that comes to the Crick should be late-stage milestone like registration or royalties, in order to enable the business to really do what they should be doing, which is develop the innovation. And we are not looking for upfront payments for licenses, etc., that will be detrimental to progressing the innovation. And that's something special that Sir Cooksey and Paul have been behind, about making translation core to the Crick and allowing us to have that long-term view.
No, perhaps it's too complicated to go into the detail. Can I come to my second question? And that is, in the written evidence from the Institute, it says that there should be an ecosystem approach to innovation, and that there should be the right skills embedded in the academic environment so that discovery science with potential for transition and development of IP can be identified and nurtured. Can you tell me a bit more about what you think the ingredients of the ecosystem should be? You know, what skills and experience are we talking about, and how they should be embedded?
So there is, the first part is we have some scientists like me who come from pharma, who are embedded with us. So we have a collaboration, an alliance with GSK and AZ, and they have scientists embedded with us who do pre-competitive research with us and work side by side with our scientists. And the experiment we're doing is that by having curiosity-driven scientists with applied scientists, we will be getting the foundation of the science that will have the potential to be translational science. And we can also increase the probability that we identify translational science. So it's more industrial scientists, and we have technologists to hear from different technological companies as well. The other mix in the ecosystem is entrepreneurs, which Charlie mentioned is really important. We have entrepreneurs working with us, working side by side with scientists, who really discuss at the inception of the idea, how do we shape those programs so when they develop, they have already the right form. And investors in residence, so we have Wellcome Trust, who is highly supportive and, you know, give us pro bono, really, people. Same with SVLS. And they're here to say what's the proposition should be. Is it a right way to shape a programs towards an investment? And the clinicians are the fourth area, which is how do we embed clinicians from our universities partners. We have Charlie, and we're very, grateful to have Charlie But we need more clinicians to be embedded in the Crick, because they bring the clinical insight we need to be able to do the innovation in health.
Like a specialised Innovate UK? Perhaps that's a tricky question.
Well,
but,
I guess they are embedded here. So the proximity is really important. The fact that those experts are on tap in the building with us, and being able to talk science in the multilingual way you talked about. It's important to be multilingual, to understand how you can speak the science language, the finance language, the business language. It is part of the core of what we're creating, and developing those scientists and the postdocs being multilingual through training that we do with them.
Thank you very much. Very interesting.
I think to the scientists that all this talk about strategy, industrial strategy, science, innovation, and industrial strategy will make scientists who just want to do science and not think about taking it to innovation feel that you will not be valued as a scientist if you weren't also the scientist that takes the science to innovation. I mean, do you worry about that, or do you think, let them carry on and I'll do my science?
I mean, there's a danger of that, of course, but one of the things that is also emphasized in this particular strategy is the need for a very strong and wide science base, and provided that is really seen as a fundamental pillar of the strategy and is not sort of forgotten along the way, then that value, I think, will be preserved. The notion that everything will happen just by lowering the energy barriers, I think has some merit to it, that there will be some discovery scientists who will be more prone to try and find an application and move their findings into sort of an innovation path. But there is one particular resource that is always limiting no matter what, and that is time. And in the end, you always are going to have to make a personal choice in terms of your time investment into each one of these activities, and that ultimately is dictated by your interests and your motivations.
Okay. Lord Mexton, quickly, then I'm going to move on.
Yeah, could I very quickly just say that, yes, all of you are very committed to extending the life of people through the research that you do. Are you aware that there are enormous political problems associated with that? I talk as the professional politician here, in that if you extend people's lives, then the number of people who are going to be paying taxes to pay for the people who are going to live longer gets smaller and smaller, and that must be something which does concern all scientists as well.
I think the question I've got really is to both Professor Swanson and Dr. Biro. If you're a young researcher here in the Crick Institute and you've got a great idea and you think it would be terrific to try to exploit that, you know, what is the first thing that you say to him or her? How do you he or she comes to you and says, I've got this great idea. What next?
Well, it depends what the idea is, obviously.
Of course.
But, you know, I can only speak from experience working here and, you know, before its predecessor at Lincoln's Inn Fields. And the great thing about science is, you know, you really can make the impossible possible. And, you know, I think to squash enthusiasm in, you know, a junior scientist who's on his way or her way up is criminal, and nobody here would do that. I mean, you know, the great thing about this building is you can walk into a Nobel Prize winner's office, call them by their first name, and assuming they're in and they want to talk to you and they've got time, you can really get, you know, very important information from them that will help lead the science. I've never found it a problem. It's very, very easy to get enthusiastic support for the work you're trying to do.
But specifically about, they've got a great idea and they want to spin it out.
So in terms of spin-outs, I think that's encouraged too. I mean, there aren't any barriers here. There really aren't. I mean, it's been incredibly straightforward. What's been difficult is finding the money, finding the investors, and finding the right investors who also believe in the science and will provide some latitude for you to get on with the science and translate it. And finding the right investor is much, much harder, I think.
Well, I think that's really behind my question. I mean, so here comes this enthusiastic young researcher, got a great idea, wants to spin out. What happens next? How do you help that researcher to address those very questions you've talked about?
That's what Veronique's that's what Veronique's team do, and they do it very well, I think. You know, they are extremely encouraging. You know, it's a collegiate relationship. We talk through the problems. We've got legal counsel that can help with the IP. They've got lots of contacts, you know, VC and what have you, to access funding. Yes, I think it's fair to say, you know, as we discussed, the you know, capital investment in the UK is not as good as it is on the west coast of the US. But, you know, that said, you know, they do a good job, and there is money available, like, for the right idea, actually.
Very quick with a one-word answer, I think. Dr. Biro, are you having too many people walking through your door with ideas, or too few? And if it's the latter, how do you encourage it?
It's the earlier. So we have more ideas at the moment than we can support.
Okay, thank you.
You've been a clinician before, but the environment in our hospitals, and you know, Sir Paul Nurse in his evidence said we need to change the NHS to become a research organization. The enthusiasm of bright young clinicians and scientists is killed off by whatever NHS demands of them. Or do you disagree?
I think you've raised a very, very important point, Lord Patel. I completely agree with you, and it's a big problem. And that's why I think we need to train PhDs much earlier in their clinical careers, before they've got jaded by service and the pressures of, you know, running a 70-patient clinic with 2 clinicians, one of whom is sick, and often that you're having to handle it on your own. It just grinds you down after a while. And you don't have time to think about science. You're just focusing on service. I completely agree. We need to think about the NHS as a research organisation, and that will need funding. We haven't talked about the problems of leaving Europe and, you know, harmony of clinical trial directives and what have you, and what will happen then in terms of regulatory
I think
aspects.
Lord Fox will be coming to it, but just now I go to Lord Borwick.
To talk about the academic reputations, should the Nobel Prize for Medicine be given to somebody who has exploited their medical inventions and made it commercial? Should there be in the judgment of academic excellence, should there be an innovation aspect to that, or should it be should academic excellence just be judged on the originality of the medical developments?
I think there's room for both. I mean, you know, I can't speak to the Nobel Prize Committee, but you know, there's room for both. I think, you know, absolutely, science and basic science and the pursuit of science for science's sake should be lauded and should be rewarded, as it is. But you know, I also think, you know, as this life sciences strategy is doing, we can also prioritise translation and industry spin-outs, and that's also important. And I'm all for generating wealth for this country to spin back into further R&D. I mean, that's what we're here for, is, you know, for
yes,
science.
But it doesn't seem to be happening at the moment.
No, but it will happen because of this life sciences strategy,
okay.
hopefully.
This is going to work. That's good.
Well, yeah, I mean, I think, yeah, I'm confident it will work if we've got the workforce in place.
It takes a long time to translate science. And if you think about Paul's discovery about cell division, it's only now that there is a medicine that treats patients with cancer. And same with toll receptors, toll genes. It was discovered 20 years ago, and it took a long time to arrive in the vaccine. So I think we have to accept that it takes a long time to translate fundamental science to medicine. And the pillar of it is very, very good science, excellent science, translate.
Longer term.
Yes.
Okay. Lord Hunt, quickly. Yeah.
So, do different countries make the speed of translation? Does it different from some countries to the other? I mean, is that the United States? You see, with this as you say, these thousands of MD, PhDs, and so on. Does it actually lead to more rapid translation? And is that a bottleneck for the UK, or maybe it's in other areas?
So what is essential for translation is a multidisciplinarity, having different disciplines together. So if you look at Boston, on that road where there is MIT, Harvard, Harvard, etc., all the people, and the business school, not far, there is the multidisciplinary, the engineers in the Crick Institute, they're all in the same place. And that's this concentration that is important to accelerate how you take discoveries to application.
Record, isn't it true that you take science to discovery like a medicine? That's what you talked about earlier on, about Paul Nurse's cell science to treatment. That takes longer time. But the other stream that we've not discussed at all, because you're all scientists in that respect, is in the United States, what is faster is the diagnostics. Do you have a comment about that?
Diagnostic is faster to develop, yes. Same for certain technologies that support the health care system. They're faster to develop. It's complex to develop a new therapy. Has a lot of hurdles to go through.
Yeah. Lord Fox.
As the sense of surprise has been taken from this question, Brexit, in the evidence submitted and also Sir Paul, has the potential for a negative impact on the whole life sciences sector. Assuming it happens, we've talked about the immigration aspects of it. Could you perhaps allude to some of the other potential challenges and how the country might go about ameliorating those challenges and whether they're temporary or long-term? I'm looking at everyone, sorry, not specifically at you, but
I think Paul made the very relevant points for us, which is, we have to have access to talent across, different areas, and that's what's going to be critical.
So what symbolically could the country do in order to make that talent feel welcome?
Make it easy for them to come with their family and their husband or spouse finding a job and their children being able to settle here. And that's what's going to be important to attract talents.
Yeah. Because I would just add that there's to encourage kind of this sense of a welcoming spirit. And I think that there's been this analogy to kind of, I don't know if it's true or not, but so please forgive me, but it's to kind of like an elite sports athlete, perhaps. It's quite difficult to get that level of training, to retain that talent, to encourage that talent to feed back into the into kind of the engine of growth in the UK economy. So there should be a sense of kind of a celebration of that person joining in the UK community, and that's really important, I think.
I think that there's two aspects to this. One is what is happening now, and the other one is what will happen post-Brexit if that comes to happen. I think down the line we do not know what impact really that will have, but right now the uncertainty of this period I think is already having a detrimental effect. And one step that could be taken immediately is to end that uncertainty for those who have chosen to make the UK their home and whose status is at the moment indeterminate. That is already causing a lot of anxiety amongst the scientific workforce in this country, leading people to begin to contemplate decisions that they would not have contemplated before the referendum. And if a clear statement were to be made about their status, that level of uncertainty might be reduced, and that level of anxiety also brought down to a more manageable state.
That's helpful. I mean, picking up on Dr. Narken's an analogy of elite sports people, on that basis, I mean, one of the things we alluded to in an earlier report is a program of actually active recruitment at a sort of nationally supported level in terms of helping international scientists to come to this country. Do you think that that would be too crude in a sense in terms of actively going out and trying to transfer people in from other countries and other research organizations?
I think I could safely say that we would very much welcome that, and we do that in our recruitment process. So, for example, if we are at a seminar or we hear a really exciting area of research being talked about, we're encouraged to approach those individuals and encourage them to apply to our institute and join our kind of our institute to contribute to that the greater good.
Thank you.
This might be a difficult question to answer, but do you know, or have you had own experiences that other European countries, in the light of what may happen with Brexit, are trying to recruit our scientists? Yes.
I mean, I think every one of us, in particular those who are EU citizens, have been already approached by a whole variety of other organizations in a whole variety of countries, and there is that there's a steady stream of that in any case, but there's been clearly an increase in those sorts of approaches since the referendum. Now, of course, this is anecdotal, but you speak to colleagues and you hear about these approaches, and some of those have been successful, and we all know of people who may not have declared it yet, but who are seriously thinking of moving elsewhere as a result of those approaches.
That'd be sad. Well, thank you very much indeed. It's most helpful to have this session with scientists and also with you. And we can see now how the Crick itself is developing and understanding how science must be taken to innovation. But your evidence today has been very helpful to us. Thank you very much for coming. Thank you. Very good. My lords, for those that are now doing the tour, Anna is going to take control.
Yeah, exactly.
And enjoy it.